Well, let me get this going. This is an unusual Grand Rounds, but one that I'm pleased to present Dr. Christine Moore for. Dr. Moore, a native of Clarksville, Tennessee, is an apple who fell a bit far from the tree because her family are all West Point grads. She, on the other hand, took a scientific road and was graduated from Oberlin College, went on to get her doctoral degree from West Virginia School of Osteopathic Medicine. She's currently a PGY2 internal medicine resident, and she was kind enough when I realized we had a hole in this week's schedule to offer to present on very short notice, something we always appreciate from folks. And she and I have this fascinating history in common. She worked at the National Institutes of Health in Bethesda, Maryland, as did I before I went to medical school. And she told me something about the NIH that I had never heard before. All the young scientificos up there now refer to NIH as nerds in heaven. And she and I both can appreciate that because I think we've both been NIH people. And at least I try and continue to be. So anyway, with that, I'm going to present Dr. Moore. She's going to talk today on how to prepare a scholarly poster. And with that, I'll hand it over. Thank you.
Thank you very much. Hello, everyone. It's a pleasure to be here, and it's been even more fun being on the psychiatry service for the past 2 weeks. This is a new rotation that our internal medicine program did, and I thought it was a great collaboration because we rely on you so much with medicine in the VA, and I was able to appreciate how much you do and how welcoming of a group you are. I think the most fun I had yesterday was being part of the surprise birthday celebration for Dr. Carroll, and she was impressed that I was in on this too. But thank you for inviting me. Without further ado, I have to disclose I do not have financial interest or arrangement or an affiliation with one or more organizations that could be perceived as real or apparent conflict of interest in the context of the subject of this presentation, nor anticipate discussing any unapproved or investigative use of a commercial product device during this activity or presentation. By the end of this presentation, you should understand the rationale behind creating a scholarly poster, review the steps in creating and presenting a scholarly poster, and appreciate the differences between a case report and a scientific experiment poster. Why do we do scholarly activity in the first place? This is how we advance the science of psychiatry and any other specialty in medicine. As physicians and soon-to-be physicians out there, we practice using evidence-based guidelines, and these are put forth through a series of randomized trials that are scrutinized by a group of physicians. In order to change the practice of medicine, we do research and we change the guidelines based on what we find. Scholarly activity is a great way to generate research in something. It would be great if we were experts in everything, but alas, we don't have the time. But we do have unique interests, and we can find a certain subject that we like and do more research and investigations into it and share that information with others to generate interest so they can follow along. This is also a great way to collaborate with clinicians. As I mentioned earlier, psychiatry and medicine, we work better when we work together. Medicine is a team sport, no matter what specialty you choose. And you find that research is also a team sport. You get to work with different people, with scientists, with PhDs, with medical students, with undergraduates, anyone, statisticians, and you find you get a better product that way. Why would you want to do a poster in the first place? It gives you a physical object that allows you to efficiently communicate concepts and data using a variety of visuals and text. It can stand alone, whereas with a presentation, a lot of what is not on the slides is what's presented by the speaker. It can also travel from place to place. All you have to do is take that poster, go to the conference, and you have it with you. Whereas with a presentation, you need a computer, you need a microphone, you need an audience, a large audience. You need everything involved. And it also allows a different set of creativity. People who are able to take an hour and fill it with everything they want in a presentation have to restrain themselves to an outline and certain data limits that you have with a poster. The other most important thing is it allows us to develop the skills to become great physicians. As physicians, we are lifelong learners and lifelong teachers, not only to medical students and attendings and fellow residents, but most importantly, our patients, We teach them how to stop smoking. We teach them how to take their medications appropriately and how to develop stress relieving techniques to improve their overall health. And you learn how to be teachers by teaching others things through your research. This facilitates a greater exchange of ideas and networking opportunities with interested viewers. It's easier to talk to one or two people about things in greater detail regarding your interests and then the interests beyond your poster than it is to talk to a group of 100 people who may not share those same interests. And this is a very popular thing among residents, medical students, and attendings alike. You can add something to your CV for fellowship, for residency applications and job opportunities. You can also present at important conferences, meet important people, and prepare for peer-reviewed publications. As well as, this is a requirement, not many times for medical schools, but also for ACGME, we have to do one scholarly activity. Case reports is what we'll talk about first. I like them, they're fascinating. You read about them and it's like a Ripley's Believe It or Not for the medicine field. If you want a good book of case reports, I recommend the book titled The Woman Who Swallowed a Toothbrush. There are many other case reports, including what happened in that case. I forget the author, but just a fascinating book. So how do you go about finding a case report? Usually it comes to you. What you find in the clinic. Maybe you had a patient with an adverse response to a therapy. Someone who you started on antidepressant now has hemolytic anemia. We don't hear about that side effect often. Or it had a personal impact to you. Was that your patient you took care of on the inpatient service, on the console, or in the clinic? It may shed a new light on the pathogenesis. In that case of the hemolytic anemia, now you have a new pathway for it or a new antibody you unleashed. Was it timely, topical? We've heard about antidepressants lately in the news. And it's topical because many of our population here in eastern Tennessee have mental health conditions. Did something uncommon happen during that presentation? Did that patient come in for a medical condition? Maybe they had a heart attack because their blood was so low and you found out in the history that they had been started on antidepressants a couple of weeks ago. That's what precipitated this. Or was there an unusual combination of events that caused this to form? For instance, what if this family has this hemolytic anemia every time they've taken an antidepressant? Or in this hemolytic anemia related to this antidepressant, what if it was a certain antidepressant at a hospital? And how do you go about finding if this is something worth reporting? Go do a basic literature search. Check in PubMed. Is it out there? If it's not, chances are you've got a great case report that we'd like to hear. If it is out there, just dig a little deeper into your case. Is there something that makes it interesting, that is unusual about your case? Go check in the textbooks to see if you can explain the pathophysiology a little better for everyone else too. And most importantly, your notes and the notes everyone else does. We don't write notes for billing and coding purposes, but it's also for future reference. It's easier to look back when you have a good documentation. From that case report and from your research, find that take-home message that you want all of us to know. Why should we be interested in this case? What can we take away from it? And then go check what conference you want to use. Is there somewhere locally that you want to go? The Appalachian Student Research Forum or the Tennessee Psychiatry Association? Or do you want to go into a larger specialty that you're interested in or that relates to your case? Many cases on the national level won't take case reports, and that's just because they have a lot of abstracts they receive, and they can't accept everything. What do you need for the authors? Do you need consent? It is less likely you need consent for a case report. Now the tricky thing is, let's say you want to turn this poster into a peer-reviewed manuscript. At that point, it's nice to have a case, it's nice to have the consent with you if you want to do that, whereas if you don't get the consent because the patient is now left the hospital, whether they are perpendicular to the ground or parallel to the ground, either way you're out of luck. And you can't have that consent and you're limited with the journals you can choose. Published manuscripts cannot be turned into posters. You can do it the other way around. And most importantly, get help. We're all busy people and we all want to share with everything we're doing. Did you have a medical student who worked with you on the service? Ask them to be involved. They are very eager to get involved, and then you've given them an opportunity to present as well, or have a publication for their residency application interviews. Get another resident on board. because they'll remember you the next time they have a case. Or get an attending. You'll need one as your senior advisor, and then that advisor will have more information to write a good letter of recommendation for you later down the road, or come to you the next time they have a case report and think you would be a good person to write that up. Make sure everyone knows what their roles are and the deadlines, because you want to have things done on time so you can get this submitted before it's due. And the better you write up the abstract, the easier it's going to be to write your case report poster. Once you hear back from them, excellent. You're now ready to make your poster. The title is the first place to go. It needs to summarize your abstract, make it catchy but not cliched, and make sure it's thorough but not too thorough. It should facilitate with retrieval for electronic searching. A lot of times conferences will put everything in, they'll put all the abstracts together and people can reference that in the future. The other thing you need to put are the institution logos on each side. That is a polite way to thank your institution for supporting you, for giving you the opportunity to train and funded you for your poster presentation, as well as set the stage for people who come. And the program directors, people who've seen your poster, will remember that institution should you do a good job. They'll remember you too if you don't do a good job, but you'd rather be in the former former rather than the latter. When we talk about scientific experiments, the same things will apply. When you have your authors, it is up to you how you want to put them, last name, first name, middle initial, or first name, middle initial, last name. Make sure the order is important. The first person is the one who's done the most work. Oftentimes it's the one who presents. That doesn't have to be the case. Your other people in the middle are ordered in order of their contributions. Avoid putting people on there just because they're your buddies or they need a publication. They may get asked about it on an interview, and if they cannot describe the poster, they will lose credibility in those interviewers' eyes, as well as everything else they may have on their CV. The last person is the most senior person, usually your advisor. It is just good protocol to put it in that order. Make sure everyone's department and institution is listed somewhere. Again, the same things will apply to your scientific experiment posters we'll talk about later. Your introduction, keep it short, but do give us the information, the basic pathophysiology on what's going on. If you want to include a brief sentence or two about the patient, you may. But save any overview, larger overarching themes for the discussion. Your case report should be the most straightforward. It's something all of us do on a daily basis, multiple times a day. We have practice doing it on the consult service, in the outpatient clinics, or on the inpatient teams. You start off with your chief complaint, next your history, your physical, then your workup, any labs, any interesting imaging, or any interventions. And then finally the course, what happened, what were they treated with, and what happened in the follow-up. Your discussion is the most important part. It gives the lessons of the case. How is this unique? Why is this different? Why do we care? Why did you make the decisions you did? Any alternative explanations, new hypotheses, things you want to do more regarding this? Make sure you avoid the mistake of calling this the first. As much as you could do a thorough job, it may not turn up everything. And many times, case reports are left unreported. Some people like to have a conclusion section if they want to recap and really emphasize takeaway points. Others make a longer discussion and just forget the conclusion. It's an editorial call. Your references do not have to include every reference. That would be appropriate for your case, for your manuscript, but in here, just include the ones you use the most and make sure you include any multimedia images or references you've explicitly used. Also, make sure you acknowledge people you weren't able to in the author section or other institutions that helped you out. The same will apply for your scientific experiment later on. The figures are important. This is part of the role as the poster to give you the visual aspects. Because pictures say 1,000 words. Interesting radiology, pathology, or physical exam findings should be listed as a picture to give us an image on what is going on. Make sure you've de-identified everything or else you'll have a HIPAA violation on the national scale. And make sure you avoid a lot of text. That's the biggest thing from a poster. It can be very weary to read text-heavy posters when there's multiple ones to review. I like to put them in the middle. It's easier that way, and then people look to the sides to read your poster. The first example I'll give is a case report I'll be presenting at the Tennessee chapter of American College of Physicians chapter. It was done with Apoorva Maddy, who's a fourth-year medical student. She's currently interviewing right now and cannot present, as well as third-year medical resident Joseph Gabriel and our program director, Dr. Deidre Pierce. It's acute pancreatitis following Google use, a case report. Acute pancreatitis is a condition characterized by autodigestion of the pancreas through injury. The most common agents are alcohol use and biliary disease. However, lipid-lowering agents have been implicated. One such agent is Google. It is a supplement from the flowering plant Commiphora mucul, and it is used for lowering lipids. It's thought to act through sembranoids and glucosterone that are involved in hepatic and pancreatic cholesterol metabolism. In our case, a 65-year-old woman presented to the emergency department with acute onset of epigastric pain associated with anorexia, nausea, and non-bilious, non-bloody vomiting. Her past medical history was inclusive for hyperlipidemia, gastroesophageal reflux disease, biliary disease, status post cholecystectomy. She seldom drank alcohol and reported a beer about a week prior to symptom onset. On physical exam, we noticed an obese female with dry mucous membranes and mild distress who had epigastric tenderness but no rebound signs. Labs were fairly unremarkable. What was notable were mild hyperglycemia, some leukocytosis with normal differential, decreased kidney function, mild triglyceride elevation to 215, and marked lipase elevation to 1061. CT abdomen and pelvis was done but did not reveal alternative intra-abdominal pathology. She was admitted with acute pancreatitis, started on bowel rest, and given IV fluid hydration and analgesics and antiemetics. Hospital course was unremarkable. She was able to resume an oral diet in a couple of days. After further workup and exclusion of other causes, the patient disclosed that she had recently started a new medication suggested by her son. It was called Google. It was for lowering her cholesterol because she couldn't take statins. When she was discharged, she was asked to discontinue this medication and report to her primary care physician any medication she happened to be taking on a regular basis, including those over the counter. Google has many other names, including gum googaloo, googaloo kalpas, and googaloo lipid. It is an Ayurvedic medicine that comes from the Commiphora plant from the Burseraceae family. It is used for the treatment of arthritis, hyperlipidemia, obesity, and skin disease. Those clinical studies have not shown significant lipid-lowering effects. It acts through the bile acid, the glucosterone acts through as an antagonist to the bile acid receptor in the hepatocytes, as well as phospholipase A in the pancreatic cells. Through this mechanism, it modulates cholesterol synthesis and metabolism. And we felt like the combination of these two caused acute pancreatitis in this patient. Interestingly enough, the National Health and Nutrition Examination Survey done several years ago revealed that the majority of Americans do take supplements, and this increases with age. Over 3/4 of patients 65 use supplements. They do not disclose this to their physicians, but as physicians, the majority of us don't ask about it. They mentioned that less than 50% ask about supplement use. This case illustrates the potential for acute pancreatitis with Google use, and also the value of eliciting a thorough history, including medications such as supplements. We feel that clinicians should be aware of side effects associated with supplements and believe the supplementation should receive more focus with the opportunity to avoid adverse effects given its high prevalence. I'll make a point. Recently on the psychiatry service, a patient came to us with acute liver, she had been on the medicine service with acute liver injury due to taking some hepatotoxic drugs while she was currently on black cohosh, which causes significant hepatotoxicity in combination with hepatotoxic drugs. And black cohosh is a supplement that's used for postmenopausal syndromes. So this is just an example of how supplement use can really have a detrimental effect on our patients. So I'll move on to the scientific experiment unless anyone had any questions for here. when we talk about the scientific experiment, it tends to be more involved than a case report. It's rarely something you can just pick up one day and say, I'm going to do a poster on a scientific experiment. A lot of us are working in laboratories or with other patients or with other teams doing chart reviews, because you need a lot of data to present, to get some meaningful results and present. It's helpful when you want to do a scientific experiment and you're part of a group to meet with your research advisors well in advance. That way you can sit down with them and say, I have this conference in mind, it's going to be due in a couple of months. Do we have enough time? Can we get everything done that we need to have a good presentation? Acceptance rates are meeting dependent, though more conferences will accept scientific experiments compared to case reports. And you can submit an abstract to two conferences, but you have to keep in mind there are certain regulations. The conference you go to first has to have fewer participants, and it's best to just check with each conference. Or you can present a new abstract when you have new data, because a lot of times you do with ongoing experiments. We already talked about the title and authors earlier. Your introduction is going to outline the clinical problem and set the stage for the audience. It gives us a background, including what's going on with this topic and any research that's been done, as well as the gaps in the research. And this is where you, as the physician, get to fill in the knowledge that's missing through your experiment. Tell us how you are going to do that. Define any abbreviations here. And also be aware that you do not have to include everything here. This isn't an abstract. Some posters I've looked at like to have the abstract in addition to everything else. I would just rather you not include that and have more space for figures. And you're going to include everything in your abstract and the rest of the poster anyway. The methods section is important and should not be missed. It is something I like to see so I can follow along in my mind with what you did with your experiment. I don't need a recipe. I shouldn't be able to recreate your experiment from scratch, but I would like to know how it turned out to be. You should include your study design, the setting in which the research was completed, the sample and control, how they were selected, how the interventions, and how you measured the outcome, as well as your method of statistical analyses. In your results, this is the quantitative section. You don't have to make any broad conclusions or explanations yet. That's where your conclusion comes in. But here, give us a description of the study sample, how things were funneled down, how people dropped out and why they were excluded, any frequencies that were most common or important, as well as numerical results with standard deviations and your confidence interval. Usually we use P as 0.05 for your statistical significance, as well as how outcomes varied among different groups, like age or gender. In your conclusion, this is very important. We want to know what the study implications are and what it shows. Why should we care about what you've done? Can we apply this clinically? Or is this statistically significant only? I can give you an example of, let's say you did a trial with a new antidepressant and you found that it statistically lowered someone's PHQ score, 9 score by 1 point. That may be statistically significant. You may be hard-pressed to find a physician who would implement that in their clinics because the risks of starting a new drug may outweigh the benefits perceived. Is it supported? Are your conclusions supported by the results you've given? Do they deviate from what's already out there? Can you extrapolate this to others? Our veterans population is a great way to get a chart review and get a scientific experiment. However, the veteran population we have at Mountain Home, middle to older age gentlemen with multiple medical comorbidities such as diabetes, coronary artery disease, and many DSM-5 diagnoses. That is not representative of the majority of the population in the United States. It's unlikely you can extrapolate all of that data you find to the majority of the United States. Make sure you are concise and you are accurate. Now is not the time to be an editorialist. Provide anything in the conclusion that's only supported by your results. And include any unfavorable findings. There's no such thing as a bad experiment. We can all learn from things we've done. You may have found something new that no one ever did, or you may have found something in your design didn't work so well, and you'll just modify that in the future. Tell us what the limitations were and how you plan to improve from your study in the future. That shows your interest in the work and generates interest in the people who are listening to you present. The figure section will be more robust in your scientific experiment. You have more data to present, and you have more methods through which to present them. Think about how easy it is to show your comparison of means in a table, or your frequency of outcomes with bar graphs, or box and whisker plots, or your demographics of your patients in a pie chart rather than have many paragraphs of text. In the middle, again, is a good place to put it, and color coding is great here. 50 Shades of Grey was memorable as a book or a movie, but it won't make your poster memorable. It's hard for me to go to a poster that looks like a bleached zebra. I like to see color. It stands out. The example I'll give, and it shows it pretty well on the bigger screen. In the earlier presentation I did, it was a little hard to see. At the Appalachian Student Research Forum this past year, I did work through the laboratory with Dr. Krishnan. He's a hematologist-oncologist at the medical center, and he's doing, with the Department of Hematology Oncology, we looked at prostate cancer chemoprevention with gamma-tocotrienol. Chemoprevention looks at molecular pathways that targets cancer growth at the early stage with minimally toxic agents. We like to target cancers that are slow growing because they are the ones where the prevention is more able to stop the cancer before it gets to be a big deal. And prostate cancer is prevalent in the community. Vitamin E is a naturally occurring substance found in our foods and exists in multiple isoforms called tocopherols and tocotrienols. It has been studied as a chemopreventative effect. Unfortunately, the largest trial to date, the SELECT trial, only looked at one of those isoforms, all-racemic alpha-tocopherol acetate, and it found that it did not prevent cancer and actually promoted cancer. In our laboratory, we looked at several isoforms. In this study, we looked at alpha-tocopherol, gamma-tocopherol, and gamma-tocotrienol, and their effects on the enzymes AKT and pERK, also known as MAPK and MEEK. These are enzymes that are pivotal in prostate carcinogenesis. What we did is we grew LNCAP and PC3 prostate cancer cells, as well as RWPE1 prostate control cells with different concentrations of AT, GT, and GT3, and then measured cytotoxicity with an MTS assay. Then we measured their effects on the enzymes mentioned earlier using a combination of Western blot and PCR, polymerase chain reaction assays, as well as their effects with and without the presence of AKT and pERK and inhibitors. And then we looked at their cytotoxicity again. And what we found in figures 1 and 2, we found that GT3, but not AT or GT, causes cytotoxicity in the prostate cancer cell lines, LNCAP and PC3. And this was more prevalent in the PC3 cell lines than the LNCAP. It also induced expression of pERK and AKT, which you can see here. Actin is a control. But what we did find is that in the presence of the AKT inhibitor MK2206 in figures 10, 11, and 6, that inhibitor did not reverse the GT3 inhibition or cell cytotoxicity. But when we used the pERK inhibitor U0126, which is figure 12, we did find that reversal right here. This is without it, and this is with it, the inhibitor. When we examined the cancer control cell line up here, we found that none of the isoforms caused cytotoxicity, yet oddly enough, the GT3 did increase the expression of pERK. So in conclusion, GT3 appears to modulate the expression of pERK and AKT through and cause the chemopreventative effects, though we do not feel like AKT is responsible for its chemopreventative, for the cytotoxicity and chemopreventative effects. It appears to be that pERK is involved in the GT3-mediated cytotoxicity process. We didn't see any effects with AT or GT. good or bad. In the future, we want to examine the other 5 signaling pathways involved with prostate cancer carcinogenesis, such as beta-catenin, mTOR, and PI3K. And what I'm doing next month, I have a research month. I'm looking at epigenetics. Epigenetics are modifiable genetic changes with the DNA through methylation or acylation that cause a change in genomic expression. And I'm going to look and see whether any form of epigenetic changes are involved with either GT3, gamma-tocotrienol, or metformin, which is something I've also looked at with prostate carcinogenesis. If anyone has any questions, I'll pause. Otherwise, I have a couple more slides. A couple more tips for how to get a good poster. Sometimes people find it's easier to try to compile your poster in prose form. It helps with the flow and the logic. It can also help you sit back, keep the big picture in mind, but break down your poster into smaller sections. It can be daunting to try to create everything from start to finish. Feedback is how you're going to get a very good poster. It would be wonderful if all of us could do things perfectly from start to finish. And many of us are just mere mortals, and we need to have feedback to help us improve. The advisors and physicians you work with will give you the feedback you need for the science portion, but those who are not scientifically minded are very important. They can help you with the grammar, syntax that can be missed. They are also the ones who will pick up on those ambiguities that you really need to sell your product to. And if they don't understand something, they'll let you know. Feedback is how we grow as physicians. This is how we are trained to become better teachers. When we can explain things more eloquently to our audience, it will help us explain things better to our patients, who are ultimately the ones who benefit from the research we do. Anything you can do to improve your poster is to rehearse it. It may seem great that you have everything in front of you, you can just walk right in and not having looked at it and just read it off the poster, but I can guarantee you if the audience sees you reading from your poster start to finish, they will lose interest. They may not appreciate that you understand everything, or may feel like you don't understand everything. And when you are prepared, you can engage with them. You can see their expressions to make sure, are they interested in what I'm saying? Do they look confused? Can I explain something differently? And it just gives you a better sense of what you can do. Make sure you keep your poster neat. Avoid clutter. It's better to explain a couple of ideas very well than to try to have all these ideas but explain them poorly. If you have a lot of empty space, you can add more pictures or increase your font size. And getting to font size, make sure you have less than 3 different font sizes if you can, but it's hard to do when you have scientific experiments where you have lots of figure legends. Try to use your largest as your title, then your section headers and your authors, and lastly, your text. Make sure, for the most part, it's greater than 24 font. That's the easiest font that can be read from 3 to 5 feet away, which is how your audience will stand. It should read left to right, top to bottom, logically, and keep your colors simple. A lot of colors will be distracting, and as we reviewed earlier, too few will be too boring. Make sure it highlights your important elements, and you can use text boxes, you can use underlines, other ways to point out the important points. When you go to meetings, make sure you have a proper carrying case. A couple of dollars will buy you a box at UPS, or if you want to get fancy, you can have a satchel to carry over you. The last thing you want is to damage your poster en route, and when you go and present a damaged poster, you've damaged your reputation. It gives the impression like that you do not care about what you're doing, which is bad for the people who are watching you. I would advise strongly against checking your poster with your luggage. I keep it on you at all times, like your cell phone or your wallet. If you lose that poster, you don't have anything to present. Rather, you lose your clothes and then have a poster. The push comes to shove, you have a poster, you stand behind it, who cares what you're wearing, and everyone they'll remember you as, that person didn't have any clothes, but boy, they got there and they presented that poster, and that just made that poster more memorable. If you don't have your poster, they won't even remember you because you won't have anything to present. If you have the opportunity to have basic equipment with you, like extra tape or scissors, which can be hard to do if you're traveling light like I do and don't check anything, it can help when you're setting up your poster. Know when and where you need to set up your poster. That is a great opportunity if you're nervous to get there, set up your poster, do a dry rehearsal. See what the room looks like, determine how loud you need to speak. The most important thing is getting to the place when you need to be, getting there on time, not being late, and sticking around for the whole time. It's no more than a couple of hours. And you'll find the time goes by fast when you have multiple people coming through, very interesting with different backgrounds. But you don't want to miss out on that judge who could see your poster, your next fellowship program director, your next employer, because you weren't there. Know when it's time to take your poster down. Conference rooms turn over quickly. People have to get things arranged for the next conference. And the people who have to take it down behind you won't be as respectful as you may because they didn't know how much work you put in. If there's multiple people on that poster, then it's not up to you to leave it behind. You'll probably have to take it back and then decide what you can do with it. The last thing is be prepared to promote yourself, not only your institution. Bring your business cards or handouts. When you're talking with one or two people, it's easier to talk about your poster, but then about other interests, and then to give them a business card so they'll remember you. That's hard to do with a group of 100. You can't just, I guess you could fling out business cards in the audience, but they may not pick them up, and you leave littered. That's my environmental spiel of the day. How to get things printed. The ETSU Biomedical Communications is a great resource. Now, this is done in error about the 3 posters. This is how the internal medicine program works. But with psychiatry, what I've been told is that the psychiatry program will fund any posters you are doing for a major conference for research. And the turnaround time for GME is about 2 to 4 days. That's what they advertise. I would give yourself more time, 30 days. Because you'll need to have your psychiatry program, run it through the biomedical communications. It needs to get dropped off there. You need to see it. If you're going for high demand months, we have our Appalachian Student Research Forum in April. They have hundreds of posters they have to present. I guarantee you it will not be done in a couple of days. When I was creating this came from the American College of Physicians website. Al Aguirre P. made a great overview on how to create a poster abstract, and I used quite a bit of his information. It was phenomenal. Some other websites you might be interested. For psychiatry, a couple of important meetings. You have the annual meeting for your American Psychiatric Association in May this next year, and your deadline is the 14th of December. If you want to go to New York City, you can present a case report. You can also do an experiment, too. The other one is the IPS, the Mental Health Services Conference. This year, the one that just happened is either taking place now or is already passed. But next year, it's going on in October. It'll be in Chicago, and your deadline is January the 11th. Now, the Appalachian Student Research Forum is not until April, and this year it's being held in the Millennium Center. Last year it was in the Culp Center. It's just local. You get to present with a lot of people through April the 4th and the 5th. No submission fee. The deadline is the 1st. You can get lunch. They have refreshments, breakfast in the morning, and the chance to win some monetary prizes. And our residency programs from ETSU have been successful in getting those awards. Oh gosh, that was a little early. The Biomedical Communications website is listed here. Moo.com, like I said earlier, I don't have financial disclosures, but this is a great website for you to get business cards. They make some of the best business cards around. It's very inexpensive. Free shipping for your first order and fast shipping for any of your orders. My favorite animal is the otter. And now I'll take any questions you have. Again, it's been a pleasure. I have enjoyed my team working with the psychiatry team.